Hello everyone, my name is Gaurav Rangari. I am a second year MBBS student studying at DUPMC Zargaon. So today we are going to talk about the urinary antiseptics drug used in UTIs and STDs. Now let's start with the definition. Urinary tract infection. What is the UTI? A urinary tract infection is an infection in any part of your urinary system which is caused by the microorganism. UTIs are of two types, the lower UTIs and the upper UTIs. Lower UTIs are more common and mainly affect the urethra and bladder. On the other hand, upper UTIs are less common and involve the kidney tissues, like in polynephritis and the urethritis. As you can see in this diagram, the lower urinary tract infection includes the cystitis and the urethritis, and the upper UTIs include the urethritis and the polynephritis. Now, what are the cause behind it? It could be a bacterial, viral, or a fungal. Bacterial cause includes the common Escherichia coli and the other gram-negative bacteria. Drugs used in the urinary tract infection are of antimicrobials and analgesics. Antimicrobials include the nitrofurantoin, methenamine, sulfonamides. Analgesics include the phenoxypyridine. Urinary antiseptics are the antimicrobial agents which is used to treat and prevent the UTIs. It is commonly administered by the oral route. It gets concentrated in the urinary tract and exert the antibacterial activity. It has no systemic effect and is useful in the lower UTI. Let's start with the first drug, nitrofurantoin. Nitrofurantoin is a primarily bacteriostatic drug and its activity is limited to Escherichia coli. In mechanism of action, what happens is a sensitive bacteria reduce the drug to an active agent that inhibits the various enzymes of the bacteria, which ultimately damage the bacterial DNA and inhibit the growth of bacteria. That's why the nitrofurantoin is primarily bacteriostatic. Adverse effects of this drug include the gastrointestinal intolerance, hypersensitivity reaction, peripheral neuritis. It is useful in the treatment for the uncomplicated UTI and the long-term prophylaxis. Second drug of our list is methenamine. Methenamine is a prodrug. It is bactericidal in activity. Mechanism of action: in acidic urine, methenamine decomposes to release the formaldehyde, which inhibit all the bacteria. It requires the urinary pH below the 5.5 for its action. It is mainly obtained by the administering organic acid like mandelic acids. It does not provide any antimicrobial activity in the blood and the tissue. And the key point here is it is administered in the enteric coated tablet to protect it from decomposing in the gastric juice. Adverse effect of this drug includes the gastritis, cystitis, and the hematuria. It should not be given to a patient with hepatic insufficiency. It is used as a methenamine mandolate in a chronic and resistant UTI. It is not effective for the acute UTI. Now let's see the other drugs which is used to treat the UTIs. First one is the cotrimoxazole. Majority of urinary pathogens, including the chlamydia trachomatis, are covered by the cotrimoxazole. It is used for the prophylaxis of the recurrent cystitis in women and the catheterized patient. It is contraindicated during the pregnancy. Now the second class of drug is quinolones. The first generation fluoroquinolones, ciprofloxacin and ofloxacin are used. It is highly effective and popular drugs. Potent action is against the gram-negative bacilli. Norfloxacin is used in the chronic UTI. Ampicillin. Amoxicillin plus the clavulanic acid is more frequently employed. Parenteral clamoxiclav with a gentamicin for the initial treatment of the acute polynephritis is suggested. Piperacillin. It is used only in a serious pseudomonas infection in patient with the intervening catheters or the chronic urinary obstruction. Fifth one is the cephalosporin. It is used in a woman with a nosocomial Klebsiella and the proteus infection. It is used for the treatment of acute lower UTI. Gentamicin is very effective against the most urinary pathogens including the Pseudomonas. Also, it is used in acute pyelonephritis. Chloramphenicol has also the same effects. Tetracycline is a seldom effective now, though the broad spectrum they are used only on the basis of the sensitivity report and the chlamydia trachomatis cystitis. Now, treatment of the urinary tract infection for the lower UTI, the short course of antimicrobial treatment is adequate, and for the upper UTI, the prolonged treatment, 2 to 3 weeks antimicrobial therapy is necessary. Empirical antimicrobial regimens for the acute UTI: ciprofloxacin, ofloxacin, cotrimoxazole, cephalexin are used in the acute UTI. For the upper UTI, like in polynephritis, the same drug may be given for the 2 weeks, but the nitrofurantoin is not suitable for the polynephritis. Prophylaxis for the urinary tract infection. When a woman of a childbearing age have a recurrent cystitis, when the catheterization or instrumentation inflicting trauma to the lining of urinary tract is performed, when uncorrectable abnormalities of the urinary tract is present, or inoperable prostate enlargement or other chronic obstruction cause the urinary stasis. The most frequently used drug for the prophylaxis of long-term suppressive treatment of lower UTI are cotrimoxazole, nitrofurantoin, norfloxacin, cephalexin. All the drugs are given once daily at a bedtime. Now the last topic of our session is sexually transmitted infections. Sexually transmitted infections are of two types: viral infections and bacterial infections. Viral infection includes the HIV warts, and bacterial infections includes the gonorrhea and the syphilis. In gonorrhea, we give the ceftriaxone or cefixime or the azithromycin. In syphilis, benzathine penicillin or the doxycycline or injection of the ceftriaxone is given. Lymphogranuloma venereum, doxycycline or azithromycin is given. For the granuloma inguinale, doxycycline or azithromycin or the ciprofloxacin is recommended. Now let's cover few MCQs over this topic. First MCQ is, what is the primary mechanism of action upon nitrofurantoin? It is bacteriostatic. In which condition nitrofurantoin is contraindicated? It is in the renal failure. The condition for the prophylaxis for the urinary tract infection, except we all know prophylaxis is not given in the pregnant woman. Indications of the cotrimoxazole are all except pseudomembranous enteritis. Which antibiotics are used in the treatment of uncomplicated UTIs? Trimethoprim, amoxicillin, ampicillin. All of the above. This is the end of our topic. Hope you like this session. Thank you.